Hello there. You are watching Mindcraft, and this is the OET series. In this episode, let us look at a few more examples for the nurse speaking section. Let us start with the following card. The location this time is a hospital. You are a head nurse. You are attending on a patient who has undergone a tonsillectomy surgery. The patient is unable to speak properly and she has difficulty in swallowing or even breathing properly. The tasks are to begin with warm and friendly greetings. Answer questions that she may ask. Assure her that problems related to speaking, swallowing, breathing will go away soon, usually go away after the 2nd of March weeks. Advise her not to pressurize her vocal cords by speaking continuously. Okay. Let's dive into the conversation now, shall we?
Good morning. I'm a nurse in this facility. I hope tonsillectomy has been done to you an hour ago. Do you have any discomfort or pain? Do you require any help? Also, could you please reconfirm your name?
A very good morning, nurse. I am Miranda. Exactly, you are right. But nurse, further to tonsillectomy, I have severe pain while speaking, swallowing, and breathing. May I get some suggestions to handle it?
Well, Miranda, I can understand your pain. It's quite common to all tonsillectomy patients. I will give you some suggestions to handle the post-surgery issues. Firstly, you should avoid speaking continuously or loudly. Try to avoid oral communication. Inevitable situation, you use paper and pen to write the message or text by using mobile or use sign or signal. Secondly, regarding the swallowing issues, you must avoid hard solid foods which are hot and spicy. Instead, intake more liquid diets, drink like stew, mild soup, porridge, etc. Eating plenty of ice cream will soothe the throat and heals the inflammation, stops the bleeding, it acts as pain reliever. Also, drink iced water and juices. Lastly, as you experience breathing difficulties, I request you to clear your airways by simple breathing exercises like inhale and exhale. Eventually, it does wonders. These are a few home remedies that you can try.
Yes, nurse, it sounds good. I'm sure to follow it immediately. But I'm a dubbing artist. I have to speak with lots of voice modulations. I feel my voice has changed after the surgery. It sounds odd.
Good to know that you are working as a dubbing artist. Meanwhile, you need to pressurize your vocal cords. Right now, you should give complete rest to your throat. It takes 3 to 4 weeks for the complete healing. Also, the change in voice is temporary, so don't bother. I can give a simple idea. Frequently you gargle your mouth with warm salt water or mint freshener. It will clear the abscess, toxicant, and makes you feel better.
I thank you a lot, nurse, for the support and personal care.
Welcome, Miranda, it's my pleasure. Kindly follow the medications and recommendations for the faster healing. Thank you.
Nice. Let us look at one last nurse speaking example before we wrap it up. The setting is in a clinic. You see a 65-year-old patient who is attending the clinic to have a blood test to check for anemia. He or she is worried you will have difficulty getting any blood. You reassure the patient and give reasons why this may occur. The tasks are to confirm the reason for the patient's visit, blood test for anemia diagnosis. Ask how the patient is feeling. Resist request to give diagnosis, example, not your role, need blood test results, etc. Explore any other patient concerns before you take blood. Reassure patient, common concern, etc., and give possible reasons for difficulty taking blood, low blood pressure, dehydration, too much caffeine, etc. Outline steps for taking blood, example, try left arm, try right arm, use vein in hand upper arm, etc. Outline results process, usually 2 to 3 weeks, sent to doctor, a follow-up appointment with the doctor, etc. Give reasons for the results timescale, example, sample sent to laboratory for analysis, clinical data sent to doctor, etc. Establish the patient's consent for you to take blood. Let us move on to the conversation.
Good morning. I am one of the attending nurses in this clinic. May I know the purpose of your visit? And how could I address you?
Hello, I am Jenny. I am 65 years old. I am here for the blood test. I suspect I might suffer from anemia. May I get a detailed information about the cause and reason for anemia?
Well, Jenny, I can understand the purpose of your visit. Sure, the blood test we could confirm any health issues. Don't bother, I know how to collect blood for the test. Let me explain briefly about what is anemia. Anemia is due to iron, vitamin B12, and folate deficiency. If you feel tired, fatigue, look pale, have irregular heartbeat, or cold feet and hands, these are the common symptoms of anemia. Anyhow, by blood test and lab investigation we can confirm it. I request you to cooperate for the same.
Sure, nurse, I would cooperate. When will I get the result of diagnosis? Can you discuss about it?
I'm sorry, I cannot disclose about the diagnosis to you directly. The doctor is the right person to inform you. My role is to collect your blood and send it to the lab for the investigation. Based on the analysis, the doctor will fix an appointment to discuss on it after 2 to 3 weeks. Is it clear?
Fine, I believe collecting blood from my body is quite hectic job to you.
Of course, Jenny, in case if you have low blood pressure, or you drink more caffeine, it could lead to dehydration. In such a situation, collecting blood is tedious. Initially, we have to check the hemoglobin level, and I will try collecting blood. Firstly, from your left arm, then right arm, also from upper arm. So kindly cooperate.
How long would it take to get the lab results?
It's a good question. Probably, it will take at least 2 weeks. Because we have to send it to the laboratory, then the clinical data analysis will be forwarded to the doctor. So, I will call you once it's ready. If everything is clear, shall I start to collect the blood sample for the test?
Yes, it's quite clear. Please go ahead.
Thanks, Jenny, for the permission. Please, lay down straight on the bed. I will check your blood pressure first and then collect the sample blood. Fine, I have collected the required blood. Hope you might be tired or get giddiness. Please wait for 20 minutes. Later, drink the nutrition shake that we provide. If you are all right, you can leave. Thank you.
Amazing. We have gone through quite a few examples for the OET nurse speaking section. Hope this gave you an idea of how you should structure your conversation during the speaking section. Keep practicing. And thanks for watching.